We're called, it's this meeting of May 26th, so it's 5:01. All right. Good night, everybody. Good evening, whatever. Good afternoon. I think y'all, but Jack, would you please help us out with that?
Absolutely. Greatest chief to the Clinton, Haida, and Sintian people. We respectfully acknowledge them as the original inhabitants of Southeast Alaska. Barlow Regional Hospital is located on the homelands of the Akwang. We are grateful to provide services in your ancestral homeland and to be a part of this community.
Thank you. Nita, could you go home and identify who?
Dorothy, Dr. Hernandez,
Yeah, here.
Dee Monk,
Here.
Chris Letterman.
Here.
Dr. Kingy. Is on.
Yep, I'm present online.
Lawrence is. Lisa Peterson. Oh. Okay. Al Geiger,
Present.
Dr. Rester, Deb Johnston. Here. Is Judy Fatma and Mari Paul is here for the mayor and Mayor Beck Buffett.
Welcome, everybody. It's for the agenda, but I'd like to make a change or two to it. Dr. Todd, I believe is online, correct? We'd like to, so I won't make any changes to the, I'm sorry, I won't make any changes to the agenda. From my end, I didn't entertain a motion for approval of the agenda as it's presented.
Move to approve the agenda as presented.
Do we have any public participation? Consent agenda now is where I need to make a change. I would propose that we remove item D from the consent agenda. There were a couple of inconsistencies on the document that was presented for approval. We'd like to move that to the medical staff report and where Dr. Cheney, Dr. Todd will be able to explain those inconsistencies. There's no substantive change, I don't believe, to it. There's a clarification on what was presented.
Correct.
Thank you. Okay. Whole business. This guy.
Thank you, Madam Chair. And so for patient days for April, CCU 92, med Sirius 377, MHU 218, newborn nursery 38, OB 54, the ED saw 986 patients in April. We currently have 6 patients waiting for placement, 4 for subacute rehab, 2 for long-term care, and 1 from each of those categories will go to Wildflower.
Home health and hospice.
So in the packet, you see a new dashboard that I've been working on with the team. What I can report as far as high level hospice referrals and admissions continue to be above the prior year in the last 2 months. The conversion rate, this I discussed in the finance committee, benchmark is 70 to 80% because not everybody is always appropriate. And so that's a good area to make sure we're checking ourselves. But the patients that were not admitted were because they died prior to either discharge or coming on to services. Average daily census continues to go up and is up again in May, exceeding April. And a point about average daily census is when you're looking at sustainability and financial sustainability, it really is about days of care. And so your census fluctuates up and down. But at the end of the day, it's how many days did a patient and family receive that care. Length of stay, this is a new chart, but what I can tell you is that the predominant number of patients that are on service live between that 0 to 7 day period of time, which is not unusual here. Home health referrals and admissions, we are going to be the highest in May, but we've been trending upward both in admissions and in referrals, and that is continuing into May. Conversion is now within the benchmark, but I'll just point out that the non-admissions in home health, the majority of them are due to not having a skilled need, not being homebound, or refused services. Home health, the average daily census, there's a lot more to health of a home health agency besides the census. A lot more goes into it, with such as the type of referral, where they're coming from, if they are recertified in that benefit period, what diagnoses they have. Timely initiation of care, we continue to make progress there. The benchmark is 85%. And what I've learned is that a lot of it is simply the delays in a patient being discharged either from Anchorage or Seattle, and the information was not updated. That is much higher than what's been objectively reported. But going forward, we're now making sure that those updates are present in the OASIS that's completed. Home health hospitalizations and ED visits continue to go down, which is a measure of staff support and teaching. And our LUPA rate in April was 0%, which means that patients did not go back, did not end services prematurely, and days to bill continue to go down. And a lot of projects that have gone into this that are ongoing and completed. And the team is doing a real good job.
Could you, for those who might not have been, could you define LUPA?
Sure.
For the
I did on this, I did a, yep. So any of those, I tried to make sure that there was an explanation because the data is for data nerds, but happy to help.
Hi, good evening, everyone. So our average, so for April Walkway report, the average daily census was up to 51.77. So just a little under 3 points there, which was good. Occupancy rate was at 82.17. As of today, we're at 53, but we had a few discharges over the weekend. But we do have 4 admissions coming up. So getting us right back up to 57. Any questions?
Thank you. And Mr. Gross.
So, touching base on upcoming things, we're working on scholarships now. All of the scholarship deadline has been completed. We have about 29 applicants. 5 are returning Edelmans, and I think it's either seven or 9 new high school students as well. So quite a few Bartlett employees. Pretty excited about that. So we'll be going through those this next week. Hoping my scholarship committee will have some time to start working on those and going through those. So last year we gave out about $30,000. So we're hoping to be able to do that again this year for our students. As far as other things, we have the Bartlett Loves Babies campaign, which might have a slight name change, but they're working on it. It's a competition within the OB department. So we'll see what they come up with. They're still procuring some of the some of the items that are coming in. They had some problems procuring a couple of things that were being shipped to Alaska, so we had to help them with AML getting things shipped. So hoping June now. I was hoping for May, but hoping for early June. Then we helped out with Hospital Week and we did a few spring wellness activities and things. And then my office is now right here. Right behind you, so. Any questions? We've had about $48,000. Cheers.
Any questions? Okay, thank you. We have an A3 presentation. Right. Sure.
Hi, is that my cue?
That is your cue.
Hi, everyone. Thank you for having me. My name is Charlie Gribben. I am the infection preventionist for Bartlett Hospital and Wildflower Court. I've been a nurse at Bartlett for 20 years, so I am really excited to give you guys this presentation. Yes, so we are, as a hospital and the nursing home, working on improving our hand hygiene overall and meeting the Leapfrog quality standards. Did anyone in the audience not familiar or has not heard of Leapfrog? Okay, I'll keep going.
Our assembly members. Okay.
Okay, yeah, I'll cover the bases. Leapfrog was founded about 20 years ago in response to patient safety observations in healthcare. So they've, over the years, been helping hospitals develop overall really good patient safety practices and standards. They're a little different than Joint Commission, but they have high patient safety standards for quality. And so we as a hospital have been asking Leapfrog to rate us and give us a grade so that any consumer needing healthcare can see overall how safe our hospital is. We are currently sitting at a B grade in healthcare on the Leapfrog website. And one of the ways that Bartlett could easily get from a B to an A is to upgrade our hand hygiene. So currently, we have good hand hygiene. We monitor, we provide feedback, but we don't do all of the 5 elements. So Leapfrog wants us to monitor and collect good data. In order to get data, you have to give a good statistical sample. So we are trying in one of these goals to get to 100 pieces of data on whether or not people wash their hands in 1 quarter. So 100 observations in 1 quarter. Then I compile that information that we take from observers and give that feedback. So people need to know how we're doing and provide real-time ongoing feedback on our compliance information. The next part is education and training. Even though hand hygiene is something we've been taught to do since we were 5 years old, practice does degrade as we get stimulated by all other kinds of healthcare. Maybe somebody's dying of a heart attack and we need to rescue, or we get kind of sidetracked with all of the other things we have to do as healthcare and provide good, safe care. So my job is to educate the importance of hand hygiene, make sure people are doing it right, so there's not any confusion. It is a complex behavioral practice that we do. So I use GlowGerm and make sure I teach people on how to do the right techniques on hand hygiene. Then I have to repeat that and make sure people know it continues to be important. So that education and training needs to keep going. When I do get this data, I have to provide realistic and meaningful just-in-time feedback. So if I'm rounding and I don't see somebody wash their hands, I have to stand up and say, hey, I noticed you didn't wash your hands. Is there something I can do? Let's talk about your technique or why or that kind of thing. Next, there has to be infrastructure. We have to have the right hand sanitizer, the right soap, have our system set up so that people just see the hand sanitizer, see the soap and water. Our sinks aren't going to contaminate you and make hand hygiene hard to do or inefficient. And then lastly, and the most important is hand hygiene needs to be important to every person and every organizational level, from our staff who are providing the care, our EVS people that are providing the cleanliness that reduces surface contamination, and then to our senior leadership so that everybody knows this is just as important as any other job in the hospital. So those are the 5 elements. What my improvement project is picking this up again. This is part of my job description, is to monitor hand hygiene, educate, and do the data. But I haven't been doing it as well as I could. So I am meeting that Leapfrog standard to get that 100 observations per quarter. So that's 3 months. Each unit has to get that. So I am talking about it. I am training my observers. We've got more and more observers to do this. And the idea is that we need less biased data. Because obviously people see me and they wash their hands instinctively, not adhering to the 5 moments of before patient care, after patient care, all those things. So, the goal right now is to meet that 100 hand hygiene observations in each unit. And I'm happy to report in Q1, we did, with the exception of a couple units. So I've got more people interested in being the observers and trained on how to collect that data. I have also been able to provide feedback and get that. Are we getting our observations and what is our compliance data? And the next step now is to make sure we have a good system that's ongoing with education and training throughout the year, and feedback throughout for everyone, nudging to make sure everyone knows how to wash their hands and that it is still very important to reduce infections. And then leadership. Leadership does rounding, but I don't know that they're actually participating, or I know they're not actively participating in collecting that data, or comfortable in providing that feedback. So that's the next step here, is to facilitate a safety culture where we can talk about these things. And that's where I feel sometimes I need help in managing those awkward conversations and giving people the right feedback so that they are comfortable with that feedback. They can ask me questions as an expert and subject expert knowledge in making sure people wash their hands, and the importance of not relying on gloves too much, and when to take them off, when to use gloves, and stuff like that. So I ran through the A3 in here. I think I touched on every aspect, but I might have gotten a little tangential, as I do. Is there any questions or anything that I missed and left out?
Thank you. I hope we hit our goal. Sounds like we're well on our way.
I think so. Yep.
Thanks again. All right. Dr. Totten.
Thank you, Madam Chair. Can everybody hear me okay?
Yes.
For the medical staff, we had hospital week recently, and I just wanted to point out that we were able to award a Nursing of Excellence Award to Jessica Chavi, one of the ER nurses, who is also fun to report was one of our local paramedics transitioned to the hospital, and that was a real honor to be able to do that. Joe also presented a Physician of Excellence Award to Dr. Matt Tainer. So just to recognize good work of some providers in our community. That's all I have for This part, business as usual, otherwise. Oh, and we should talk about these. So the reason that these two delineation of privileges were pulled out for review is the highlighting is confusing. If you looked at the OB one in detail, you'll see that what's highlighted in the packet is delivery of fetal demise, which has nothing to do with any of the changes that we were done. That was just a miss highlight. The only changes in the two privileges for urology and for obstetrics and gynecology are the addition of privileges to use a laser if that provider already has privileges to perform the procedure. So if they're going to do this particular surgery anyways, then they can use a laser if they so choose for that surgery. There is nothing to do with fetal demise actually contained within the changes of these privileges. That's all I wanted to point out.
Thank you. No substantive changes, just clarifying some confusing highlights.
Correct. Yeah. No wording changes. No wording that was inaccurate. It was just confusingly portrayed, I would say, in the highlights. That's all I wanted to clarify.
Thank you. Are there any questions about that? If there are no questions, then I'd entertain a motion to approve the delineation of privileges for those three, I believe, two or three? Two.
I'm sure. I move to accept these changes in the delineation of privileges.
Second.
All right, committee meeting updates. The CEO Compensation Ad Hoc Committee. That's me. I was sorry, I was looking. But gee, I thought I would just donate that. The ad hoc committee met. Minutes are accurately reflect what we discussed. We were able to bring forward to first the governance committee, who subsequently passed on the goal setting. And you'll hear more about that in the governance committee. And also we passed on from there, it went on to the finance committee. But if you have any questions, we're going to hear more about that in both of those committees, the governance and the finance committee. Questions? Okay. That moves it to Hal for the governance committee.
Okay, so the governance committee, there's a couple, you can read for yourself the minutes, but there's a couple things I would like to point out to you. We did go through the CEO goals executive session, and those aren't in the minutes, but that we'll come to that presently. Under old business, in years past, the governance committee recommended specific topics for education and looked into how to actually implement that. But this year, after we discussed the survey of board members, we surveyed board members and asked what education topics they thought were important. The committee this time reviewed that survey, and we decided to let staff look into opportunities for us. So we'll be waiting in coming days for staff to approach us, much like they did last year, with suggestions for how to actually. What was the other thing I was going to point out? The computer keeps flipping back and forth. Oh, the board engagement too. So there's been for the last couple of years a lot of discussion. There's some discussion, and particularly last year, about getting the board more engaged. It was an A3 that we talked about at the last board meeting, and so we talked about things we might propose. But in the end, we just decided to bring forward a calendar of events for board members to be invited to get engaged. So that we'd make board members aware of that, and then we can track how many board members showed up at these things. So if you you've looked at your minutes already, or your board packet already, you know the next event coming up is event with the Panhandlers Motorcycle Club. So if you're interested in seeing who turns out for that. But it's still kind of lean, but look in coming months for invitations to participate in different things. And we didn't get, I don't think we got to count on how many people showed up to go in the dunking machine at the at hospital. Well, yeah, I don't think we got that recorded. I do know at least one. But anyway,
Well, there were a couple.
there were a couple. Next year, we'll look for more board members showing up in their Speedos.
It was one of the surgeons.
So anyway, that's all I've got. Remember, are there any
I
questions?
did want to mention that the intent with the board education is we've been trying to have a K3 at every meeting as close as we can. Joe had proposed that every other meeting had a board education session, and the opposite meeting would be an A3. So that will be look forward to the cadence being every other meeting for education.
Are there any questions?
We do have an action item. Oh, actually, we don't have an action item. That's the next one.
Then, Chair, at what point do the goals that we worked on actually sentences, what point are those?
But we didn't.
I believe that was a lapse in putting together a packet. I apologize for that. It should have been an action item that comes out of governance.
Okay, yeah, there was some confusion about that. What the confusion was about was the fact that we were in executive session and what could come out of that. And so when will that all be reviewed?
Next meeting,
Next meeting, okay. Thank you.
since we can't vote, we can't take action on it without. Okay. Max was unable to attend this evening, so if there are no other, Lisa's not here either. So,
Guys did ask me to do the finance report.
but the quality and compliance, is anyone here?
I was at the meeting.
You were, okay, thank you,
Do you want me to go down?
please.
Okay. Quality and compliance, there were some issues with updating the prior facilities compliance and Gail. We submitted all of those. There were really no substantive changes. And so no other major, just business as usual, right? Okay, Gail, am I missing any big major policy changes? Okay. And we had to approve because we did not have a quorum the previous meeting, but I don't think there's an action item to approve, is there? Since we passed that, is
They
that?
were on the consent agenda.
Oh, they were, okay, right. Thank you.
Okay. Max was unable to attend this evening, so Finance and Audit Committee.
Yes, sure. Well, so we do have an action item, but I think that's for executive session, but now we may not be able to do it because we don't have that. Well, or just wait till talk about that in executive session. The action item is listed here, but I believe we have to have the discussion in executive session. Correct?
There's two documents, the one being audit and finance committee. And the other one is to be discussed in executive session.
So the document that was included in the packet is available for an action item.
Okay. So included in the packet, and many people now have seen this since it's gone to finance and governance. But if you want part of that, we have a list of goals and performance metrics and how we will measure the goals included in the packet. And this has been kind of discussed in quite a bit of detail. I think the piece that isn't here that Howard was referring to was the governance committee spent some time outlining an actual sentence goal. So the goal is quality, but what does that mean? So there is a draft of those goals that will. The time was spent kind of outlining how are we going to measure? Everybody agrees we want high quality care, but how do we actually measure that and then translate that to performance metrics for the CEO? So I think we're going to talk about more details in the executive session, but for now, at a high level, these are the metrics that we have identified. If anyone has questions, I can discuss it now or it'll come back up. So is our action item now to approve these or is it to wait till after? Okay.
So I'd just like to comment that these goals, these performance metrics are in alignment with our strategic goals that we approved in January. So if you look, you can tie them to each of the strategic goals.
So do we have a proposed motion for the action item? Or
We
is it?
don't,
Okay.
it was already moved by the finance.
Okay.
It was another board.
No, we just need to vote
We,
on it.
so
So
the same motion, or the one, that I guess the finance committee just put forward a motion. Okay.
we don't need a motion, a motion in a second. Are there any questions for those of you who might not have seen these in any of the committees that they were presented?
I'm sure I've seen them, we've discussed them, but since there are, if this is a public meeting, perhaps you should briefly, someone should briefly explain what these are. And we should maybe have some discussion for the record, I think.
Or individual, one by one? Is that what you're suggesting?
There's no discussion of money. I mean, there's just the spreadsheet and there's objectives, but there's no discussion of money here, I don't think.
That would be an executive session. I think.
And so the next step of this, these are the performance metrics that we're asking the board to approve. The next step is, and it's stated in the motion, in the finance committee motion, that the next step is for the board chair and the finance committee chair to work with our CEO to develop
Performance-based compensation.
Yeah. The agreement.
Okay, then if I could continue, so these have been carefully looked at by multiple people, including me, and I'm in favor of this, and I'm going to vote in favor.
Are there any other questions? Are there any objections to the motion that came out of the finance committee? Seeing none. The motion is approved. All right. Your Honor.
Thank you, Madam Chair. So in the CEO letter that was in the packet this month, I kind of went over kind of the projected impact, the one big beautiful bill that we'll potentially foresee in future. These predominantly are Medicaid enrollment numbers that will be impacted by the various different measures they put in place. And when you look through here, the estimated coverage loss ranges from 9,400 to 13,600 statewide. And so when you're looking at the decrease in Medicaid population, that population, when they lose coverage, will most likely roll over to bad debt or non-covered. So we expect a decrease in total compensation. I just want to keep bringing this to the forefront, why we are working on rural health transformation. The big piece of the bill that isn't being talked about as much is the decrease in Medicaid enrollments that we are projected to foresee in a couple of years. I know that we have a January 1st date as the Medicaid policy change in committee, specifically the work requirement. I know there's a waiver application that the state's working on, and that's my understanding. I couldn't push that back into late of 2028 until that's approved. We don't know. I just want to make sure the board's aware that we could see decreased Medicaid enrollments in the future. We just, the fact that we need to be diligent with our programs and to remain diligent as we look at our operations moving forward. With that. On the other side of that piece was the rural health transformation. We have put in LOIs. I've spoken about that the last couple months. Late last week, we were informed that 3 of our LOIs will be moving forward in the application process. The 3 that we're moving forward are an EMR, a change in our medical record. So we have put in an application to move us from our 5 medical records to a single application that would contain all of our medical records. We were working on that application. The second one was to stand up a cardiology clinic in Juneau and funds to help assist with that. And the last one is a secure communication platform. It's basically taking our Tiger platform that we use now and expanding its utility. So those were the 3 of the 8 programs that we submitted that we moved for the application. The state has said this, and I think we get not all these, this doesn't guarantee funding in any way. It's just moving to the next stage. And so the hospital association projects that more applications are still moving forward and their response to go out. So we expect at least some of these to not be moving forward past this kind of stuff. We're going to be looking at the applications that didn't move forward and trying to revise those, see where we didn't have fits, trying to work on those. We felt like of the 8 we put forward, they were all good candidates to move forward. As we look at year 2 applications, those can be from that as well.
What was the total dollar amount of the ones that are in the public or a range cost? In the nearest.
$7 million estimate, okay, total.
For just the 3?
And the biggest one, Joe, is probably the medical.
Medical record, I think we estimate 6.5 for that.
Okay.
So that's the book. You guys might be able to tell me if I'm wrong, that's my guess. Any questions on rural transportation?
And so the work requirement, there was the native population actually had that removed. Is that work requirement possibly going to be pushed back for everyone in Alaska or how about for the state? of
Well,
Alaska?
there are exemptions that are in place that will include native population. So like native population, there's exemptions based on employment rates in the community. I think there was 8 to 10 exemptions that would be in place
In the bill already.
in the bill already.
But there's possibility that others.
This takes those into consideration.
Okay.
There's that exempted. So the big one is the work requirement, and then the state can submit a request for a waiver that would delay the implementation of the work requirement. Off the top of my head, it was late 2028 was the latest it would possibly be implemented, but relatively, it's in the future in a short instance, I'd say. Is there any other questions on that?
You had some data on the marketplace enrollment in coverage.
Yeah.
You can talk about that separately.
I can chat about that. And so when we looked at just ACA expansion population and the reduction in subsidies, there was already, as we went into the application process or the open enrollment period, there was a 14% reduction in the marketplace just initially, with a 26% reduction in the population that was receiving the premium tax credits. And so the Hospital Association reasonably estimates that we could see that 14% increase to 26% decrease in ACA enrollments. And so these are commercial plans that we have in Juneau. In total, it's somewhere between, I think, 200 to 400 people would lose coverage in the Juneau area. We're estimating at this point based on these numbers. So anything about, we have to continue to look at the impact of this. I mean, it's hard to analyze when you look at the high level numbers. We have to look at this on a month-to-month basis to see if we're actually seeing decreases in these populations. So what's not known in this is when someone loses coverage, are there other insurances? Do they have employer coverage that they haven't elected? Is their spouses change of circumstances? There's a lot of unknown factors that we can't take into consideration. So we need to continue to watch our care volumes for Medicaid and commercial plans in the future. these do drive strategic, obviously changes, coverage volatility, revenue pressure, reimbursement pressure. So it's just operational readiness is all I'm stressing at this. I think a lot of our work we've done over the last couple of years in this position as well. We're adapting, making changes at this point, and trying to be as flexible as possible. Most of that was good news. We did learn last week that the Senate has moved the rural demonstration program forward. So they voted on that and it passed unanimously and it's gone forward. The House has introduced legislation, matching legislations. There's a high likelihood that that's going to move forward in the near future as well. So we were able to meet with Murkowski's staff this morning. And so they feel like there's a good chance that actually gets approved in June from the conversations they're having on it. So we have that to look forward to. Last year, I think it was 4.2 million. It will be based on what the cost report comes out to. So number could flex on any given year based on cost, based on Medicare utilization and inpatient treatment, stuff like that.
And broadly, that could move our margin from a negative 0.3 to a positive 4 or something with that, right?
If it's moving us forward, yeah. It won't move us backwards.
Right, no, that's, I mean, it's amazing. It's like, thank you.
And we anticipate that they will retroactively.
The bill takes that into consideration that any hospital that was in the demonstration will be brought back into it once it's approved. So they retro us back for this fiscal year. Which would tie back to our cost report that we'd hopefully file in October. So yet to be determined what the total impact was, but there's good news on that front. There was also another bill introduced last week that could be extremely beneficial to Bartlett. Is the Rural Maternity Options for Medical Support Act. What this bill does is it exempts OB beds from the critical access bed calculation. So as we looked at critical access in the past, one of the big problems we had was we passed that threshold. But when we take the OB beds out of consideration, we become a great candidate for this conversion. And so this is something we'll be watching very closely, because if they pass this bill, it makes critical access a no-brainer price. Then we need it on every front. It's moving forward. It would be extremely beneficial to Bartlett.
And nationally, because a third of counties don't even have active OB, so it's a huge national problem. And so nationally, where is this bill?
The House has introduced it. It hasn't passed the House yet, so it's been introduced on the House side, and so if it passes there, there's a high likelihood. What Dr. Rathter is referring to on a national level, there's maternity deserts scattered around as people have closed OB for various reasons. There's a lack of physicians, the cost of malpractice, the complexity of the program, reimbursement issues. I was at the National Rural Health Association conference last week, and then this bill was probably the tip of everyone's tongue, because the number of hospitals this benefits in the deserts it closes is huge. So I see there's a high likelihood that this moves forward, in my opinion. When you sit and talk to hospitals and then patients are driving, 4.5 hours one way to go see the OBGYN because there's not maternal care in their area. And then the impacts of that, either they don't receive care or they end up delivering the ER. So, high hopes for that one. If you get a chance to talk with any of our delegates or senators, I appreciate you pushing in the right direction.
There any thought of promotion from, rural communities that would kind of like a standard, like regular person and say how this would benefit Southeast Alaska and, rest of Alaska, because I mean, obviously we're the biggest impacted because like Homer probably isn't, right? Because
Homer's already critical access.
Okay. But like other communities are either big.
We're probably the
Or like
only
in
one
the-
that's impacts in the state.
Okay.
Can you ask AHA to advocate?
Yeah, I can kick it over to Jared now.
Yeah.
I know the American Hospital Association
Yeah.
has already advocated for this as well.
Could you give some key words to use if we were to rate it?
I can put together a memo, probably after this would be more concise than me trying to ramble it off, right? I'll be fair. But look for an email from either me or Nina the next day or two. It's something up to you guys. I want to follow up with that conversation with anesthesia. I mean, we've talked about this once. We were able to find coverage for the gap that we had emergency authorization for, as we discussed last board meeting. So we didn't have a lapse in coverage from anesthesia. We are continuing to strive to that team-based approach that we've discussed and that was pushed forward by Credentials. So I know Kim continues to work. We're looking to find good qualified CRNAs to add to the mix. We had a good meeting with the group of anesthesiologists today. We've asked them to kind of put together a proposal from their perspective, what would work, thinking of a team-based approach. There seemed to be a good meeting this morning, lots of good questions, lots of good comments. So we're hopeful that we're able to move this forward. As we look forward now, our current group will provide coverage through September 21st. And at that point, we would transition to a bar. So that's what we're working towards.
I'm sorry, you said we'll transition to a Bartlett, what was the next word?
Bartlett-led model, Bartlett employee, Bartlett contractors.
Any questions?
Questions on that?
Particular, because we have discussed this fair amount.
Not sure if I have a question, but not sure if it should be an executive session about what that looks like. For quality.
I was, picked the executive, I guess that came from the staff.
It-
It involves Credentials, so it probably should go to executive session if I may suggest.
And the last piece is more of just the housekeeping issue. I've discussed this at Med Staff, so some of you guys have heard this note already. We do have a badge policy. So what we're looking at is how people use their badges. And so I'm hopeful that all board members have a double-sided badge at this point. And just ask that if you don't, please reach out to HR, get your second badge to be in compliance with our current policy. And so it's a simple housekeeping item. Me and Chad were looking at the various, as we discussed this in other committees, we're trying to find a way to distinguish boards and can we do it through the badge? So me and Chad were looking at the software a little bit this morning. We're not quite confident on that, so we had to pull some help. We're gonna look at it, see if we can get board members a slightly different badge, maybe stands out.
It's yellow.
Yeah, it's yellow, but so is every other non-employee person at the hospital. So contractors are yellow.
They should just making a separate yellow. But they just made me mine.
Isn't that everyone that's not employed?
It's very, very similar. So yes, we have, the templates it's a non-employee template. It's what it is. So the question is, could we come up with something that's maybe just even a little bit nicer for you guys that would be represent you as board members? So just a thought.
You can apply badge policy here too.
We're not ready. I shouldn't run down tomorrow morning and get a new one because we're not quite ready for it, or should I get it?
Give us a couple days for Joe. Lauren was out today and she's our badge guru, so I was in there fiddling around with it, and I think I broke a couple things. So,
Yeah, broke the template maybe.
yeah, somehow my picture now this big on my badge. So, no, it's again, we just want to find something that's unique as an identifier, but doesn't look like the other contractor badges. So if it's a brighter yellow, that's good. I want to make sure we have something solid. Yeah.
Okay, so any way should begin.
Can I add on to Joe's report for Hospital Week? We did also give out Forget Me Not awards and Care Award. So the Forget Me Not award honors non-clinical staff who help behind the scenes. This year, Lydia Chavarria won it. He's one of our ABS staff members. And then we also give care awards, and that recognizes non-RN clinical staff who provide direct patient care support. And this year, usually we do 2. This year we did 3 for all of our central sterile supply team who worked so hard to help us get caught up after the Tomar fire. So that was Linnea Sherdinsky, Ryan Bell, and Nolan Haynes. Just wanted to recognize them publicly for they all did for that.
Possible at all? I'm sure you have like a photo of people. Could we in the future maybe have like a little thing so that we can recognize people? Because that'll be helpful for engagement and for Hey, kudos to you. You look familiar. Like you just find something.
Yeah, I can ask Erin, to see if she could work. I did, all of the pictures are in the Bartlett bug as well. But yeah, see if that can be posted somewhere.
And some of these awards will also be on calendar. The quarterly awards will be on the calendar, so for those that can attend, you'll be able to put the name to the face in person if you have the opportunity to come and attend. I try to attend at least a couple a year.
That's the Fireweed Award.
Yeah.
Guess with that, that's the end of my report. I'd open it up to questions or comments.
No questions or comments?
I've got one question about the one project that's four projects in the RHDP. Are you recycling that for the next cycle?
Yeah, we're gonna look at them and try to figure out why it didn't meet the criteria. It could be just not enough dollars to go around and see if there's any gaps in our application. And then we'll probably be resubmitting those.
Other questions for Joe? Okay. CBJ, Assembly Liaison.
Hi, thank you so much. I am sitting in my car outside an appointment, and I've been waiting and watching the clock, and I really appreciate this. So I wanted to get the Assembly Liaison report started, but I do have to run into a meeting. So if there are extensive questions or comments, I have gifted you two of our most qualified assembly members to be there with you in person. So we have Maureen and Mayor who will be able to fill in my shoes. But a big report that I wanted to convey to you is that we've been working on this budget all this time. We did at the last finance meeting pass the finance committee's budget to the full assembly, where we will be looking at that on June 8th. That does not mean that is the budget that will be passed. There is still time for fidgeting with it. We will be having a special meeting this upcoming Wednesday because we're also looking at certain revenue measures and tax changes. So we'll be looking at those. But the key thing to know is that the pending list is normally, where you're looking at adding things to the budget. This year it was all about cutting things from the budget. So Bartlett was on there for looking at ending the $200,000 subsidy for home health and hospice. That did not happen. But what did happen was we had a request from Gastineau Human Services for $247,000, which at this point is supposed to just be a one-time request to aid in the services that they took over, or, with the same time that Rainforest closed, they took on more of that. And I know Bartlett has supported them in that. So I would be very interested, although I have to go and I'm going to go back and listen to the recording. If you have thoughts on that, or if you have questions about that did go through in this current version of the budget. So would want to communicate that to you, and congratulations on the letters of support moving forward into full applications. I know that's not secured funding, but there were so many that's still an achievement. So kudos to staff on that. And with that, I'm sorry I have to go.
Thank you. Coward.
Okay. Which one of you wants to start? Well, come on now.
Maureen's at the table, she'll be a great job.
There's a spot at the table that you can have the questions on that. So tell us a little bit more about that.
So because of the difficult position we're in, and we have these two requests for programs that Bartlett had previously had here at Bartlett.
and yes, we're committed to, hospice and home care. But, you know, it's gotta come out of someone's fund balance for the support for Gaston Human Services. And so the decision was made in conversation to have that come out of our fund balance. We're spoken to negotiations that are meeting, what is that, the 8th, 5th, 7th? Yeah, so anyway.
You said the 8th?
Yeah, and then that amount was 247,000. Yeah, because they're under some of the same pressures that everyone is with, funding from the federal level. So anyway, we're just trying to share with our friends on.
And how would you see that working? That
It's a one-time request, so this would be one time and.
So I wanted just clarification. So you're talking about reducing the amount the Bartlett receives instead of 200,000, reducing it by 47,000?
Technically, I guess.
I mean, because giving money to Gastineau Human Services is taking it from Bartlett.
So my understanding is that if that's the case, not only would we not get the 200,000 that were, but we would kick in an additional 47,000. Is that what you're proposing? The 200,000 for hospice and home care, but the 247,000 that GHS is requesting to help, with some of the overruns on their program, that we would ask if you want to be able to fund that out of your fund balance. But the net effect is that we will, not only will we not get the 200, I mean, we'll get it and then we'll turn around and turn it over to Gastineau Human Service with an additional 47,000.
Oh, okay, that's different. So it's a 247 reduction to.
Well, it's actually 447,000.
Oh.
Because we're not gonna get the.
No,
you are last year's. You are getting the 200,000 for hospice and home care. Okay, I see. And so instead of the city funding both of those, we're asking for help with the Gastineau Human Services request. So the net effect from last year, though, is a negative 47,000. That would be the.
Man, Joe, wait, he's our CEO, he used to be the CFO. So, your thoughts?
Well. Public record. So my recollection is when the board presented this to the assembly, it was to either maintain these programs or close these programs. It was elected to transfer it to Gastineau, but now we're gonna support Gastineau. So basically, we just maintain the program. The last thing was. Well, one-time funding, that's one-time funding. We're in a very different situation this year than we were when we agreed to help support both those programs in the transition. Well, I don't believe we agreed to support Gastineau Human Services, but now they're back before us with this request and we're looking for some help in our very challenging time with our budget. The loss of 10 to 12 million. Yeah, I understand that, but I would just state that although Bartlett has had some success in the short-term future, we do have significant headwinds that we're facing. We have a 5% FT budget increase that's salaries and wages that's going to come in. We have the unknowns of Medicaid, the unknowns of Medicare's. So my question would be to the assembly, if this turns sideways and all of a sudden we're in a major loss, are we situated to flip this over again? Yeah, I guess that would be an assembly. I can't speak to, but yeah, no. Joe, what do you mean by flip this over again? Well, I mean, we're coming back next, let's say it turns sideways and we're having a $6 million loss and we're coming back and we're have to close programs again. Is
At
it,
this point in our lives, you would have to close programs. We have a negative fund balance. We are having discussions on revenue. But we're not gonna get a lot of revenue. So unless something happens at the election this year. So
does it simply see the hospital as a long-term solution to its fund deficit? That's my major.
and that's why the conversation was, this was a one-time request. And so we are asking you to do the one-time request where we would continue to support the 200,000 ongoing.
Well, just to clarify, I believe in the conversation I had with someone, that the 200,000 was for 5 years. Is that right?
That's how the resolutions.
Yeah, and so when would that be ending?
This would be year 3.
Yes. It's the next budget year, year 3. Yeah. So yeah, we know at this point, we could get to that as we're able. Yeah, because it is a great community benefit that Minnesota is. Substance abuse treatment, and those were both under the umbrella of the hospital. And now we're facing very different scenario. I know we all are. Certainly with the federal picture, so.
I'm curious if the city has considered going to search and asking them to support this in an equal amount as part of this or as an alternative provider.
They have not volunteered any funds.
But that's something we could probably do though.
They have been asked before, they have not volunteered funds.
Have we've asked them recently, like not like in the past, like just so.
For this particular need.
We have not asked them for this particular meet at this time. We certainly could, but just within the last couple of months, we have asked for other things and they have not volunteered anybody.
There any statistical information about use of resources within the community that would be something that could be swayed to make public information known that like this is what we need? And like, so just basically breaking down something of like use and having that be, public knowledge. Say, we really need to.
That data is available. Remember in the listening session, this discussion has come before to ask Search to Help specifically when we're closing down Lake Forest, which was painful. Because more than, as I recall, it was 50-something% were native beneficiaries. And we had asked and the city had asked. And so that could be brought up again. It's great to hear this very high level discussion of what's going on with the assembly, with what's going on over at the hospital. But, in the sense, we have these challenging headwinds on both ends. But, we've really turned around the ship a bit. And so we don't have a vote on this, but I'm supportive of your recommended suggestions.
I might wonder if we should have another conversation in the current situation, moving forward to really start to have our community know these things, that we have many things that we want to support. And we want to support hospice and health, we want to support vascular human services, and also we're worried about Medicaid and the work requirement. And there are some contingencies on a federal level that make things more beneficial, to search.
Reimbursement base, yeah.
Right, so like,
They are very aware of that, just so you know.
I would love it if the community at large were aware of that.
Yeah.
I think we've had those discussions in public, but we can certainly ask if they are willing to chip in on this one time, then I wouldn't hold your breath, so. And speaking of what you guys said, last time it was met very unfavorably by the assembly, as you know, when we pointed out how many were search clients. I should say members of the assembly, so.
But I would say that it's a conversation worth happening and, yeah. So um, Bartlett, a year or so ago, made a commitment to repay the $2 million, I think it was $2 million, that was granted to us, of which we have already used a portion of that repayment to subsidize the sobering center. The sobering center renovation at St. Vincent de Paul's. I would entertain that, or ask you to entertain that we use this 247,000 as additional repayment. My understanding was that we voluntarily agreed to repay that, but that we use this as additional funds repaying that to the assembly for this coming year. I don't know. I don't know how the board feels about that.
Are we and what's left and what's been paid thus far?
We have repaid 1,492,000. We have 508,000 remaining payment.
Anybody comment or?
I support the ask, but that's a decision that Mayor
Remember
Weldon.
the conditions of that repayment, and thank you for volunteering to repay it. So I mean, it's not a bad idea, but I don't know I don't remember what the conditions were of the repayment, so that's why I'm being quiet. I don't.
It was going to be in equal parts over 3 years. 3 years. And it didn't work out to be exactly equal parts, and we're a little ahead of that right now, but,
And just gentle reminder that Sobering Center was also over here right before it came out into the under CCFR. So that's, yeah. It's looking to the basic for how we move forward on this. Or is that move forward? I would consider it coming out of your budget. We will, I agree that we'll reach out to search and see if we can do anything there. And I'm just making a note to see about repayment of money from BRH we use, because like I said, I can't speak to that.
so more to come on.
More to come.
Okay.
Thank you for delivering that in person. Wow.
I was wondering why there were 3 of you here. I knew something couldn't be good.
I apologize for the, lack of heads up, but this literally happened on the fly at the meeting. The finance meeting, so. You have a negative fund balance. We're in a very good position.
And we get that, we've done that.
Assuming we have like a ton of grant writer people who like try to get money from federal governments for our community, right? Like I don't know these things, so. I'm assuming somebody has written grants to get money from the rural health transformation. Do we have like really smart people to say, hey, federal government, give our community some money?
We do have a grant writer that's very active that sends stuff our way all the time to see if we can.
But since we're not writing the grant for, yes, no, human services, can we share?
My understanding is that most of the social service agencies in town have active grant writers and have, are trying their best to get their programs funded. Our experience, the experience of those social service agencies is that mental health and substance abuse is not very well funded nationwide. It's one of the lowest likelihood of funding of many of the grants for social service agencies.
That's our understanding.
We talked about a community engagement You know, where this was like one of the suggestions that was even brought up as a community chat. So maybe kind of moving forward in that case, we need to like get more board involvement, trying to come up with some sort of community events, not just like us as a board, you know, to the community, but kind of feeding to us and working with other agencies so that we can really have private donors could also be something that we can, you know, encourage people to be and stuff like that.
Do you know if Gepsno has gone out to create and like really explored all of the?
I can't speak for them. I see Joe raising.
Major driver in their deficit was a lack, they had grants from the state that got discontinued as they looked to change their program and how they issue those grants. That was my understanding.
I agree with Dorothy. I'm thinking back to when we had to go before the public and say, we're thinking closing these services to people. We have rooms full of people who desperately want the services. And I think, this might be the time to go and explain that we're in danger of, even though we're a couple of years out, we're in danger of losing hospice if we lose a few more things and get people a little more engaged. Last time we just got to spring it on the decision's pretty much made by circumstances. But I would like to see us have another one of those same style meetings we had. before.
And just one other thing that is new to the city this year that we worked in last year is the cold weather shelter, you know, the emergency low barrier shelter. The decision was made to go around with it. So that's another big hit to our budget. But, you know, hopefully we'll keep people out of the ER and you know, it's not perfect. And our census, you know, there was thought that it may drop down to 20 or in the teens during the summer months, but I think we've had 51 the other night I heard, but you know, really like December numbers in summer. And so again, part of that data collection piece, this would be another one to, you know, better be able to tell the story that this is interwoven with the hospital and our homeless services and substance abuse, you know, it's all part of it. 3%. Anyway, so that's just another bonus and total on that to go year round. I can't.
It was split between two fiscal years, so I think it's off the top of my head, right around 700,000.
Yeah. So anyway, that's you know, what we had last year over, you know, with dispersed camping was did not go well. We gave a lot of extra expense and resources towards trying to make sure people were safe. Housed at least for part of the day. Any other questions for? Dr. Patton? Did you have a question?
More just a comment. I just, in reference to the having the warming shelter open all year, as someone who does send people there frequently, I'm very thankful that we have that in our community, and thank you for supporting that, Madam Mayor.
Okay, more to come, I guess. We'll be talking. And you'll probably see a couple of us at some of these meetings. The more the merrier. Okay. There's no more questions for our assembly members. On to my report. A lot of fun at the during hospital week. There were a lot of activities we're thankful for the volunteers that came and served lunch and breakfast burritos and all the things. A few of us hit the dunk tank. I think I was, although I was dunked a few times, I did not have the number that this guy had. He was dunked a lot.
And I think every person that threw it had done it. Every single one. It was amazing. Even I did it.
That was
It was
after
like,
Nick.
Yeah.
People threw, I don't know, 12 in a row in this one.
yeah, it was amazing. He was a magnet and it was just like nobody could miss.
And we raised about $200 for the foundation.
That's not good.
Place Gabe. Place really wanted them those guys.
I think you got 3 throws for free, and then if you wanted to keep throwing, you had to donate $5 to donate for every 3 set of 3 balls. So there are a few folks that I think I was really lucky because several people hit the target but didn't throw hard enough for it to actually dunk me. So, but it was a lot of fun. I appreciated that. I appreciated being there, and I think that the staff really got a charge of it. As I was watching the different volunteers to be dunked go through, I would see repeat faces. It depended on who was on the schedule. They'd go away, and then so-and-so's on the schedule, and they'd come right back. So it was. I think it was well received by our staff, the recognition for the hospital week, and I was happy to participate in it. And it started out at 6:45 a.m. on Monday with a number of us waving welcome and happy hospital week. And so it was good. The staff did an excellent job of creating activities and ways to engage with the staff. So thank you all for that. We did have, Joe and I met with the Senator Murkowski's their legislative staff. This morning, Joe talked a fair amount about what the upcoming bills that are waiting for, we're hoping, fingers crossed, that he passed. But we also had a good conversation about what our upcoming issues are. What are the things that we're seeing? We shared with them some of the positive things that are happening for us and updated them on. They funded the ER expansion, and they were happy to hear that's in process. And they noticed when they came on campus, they noticed the signs and that they were redirected, that traffic was being redirected. Also, they probably noticed the lack of parking anywhere, or very little parking, but it was a good conversation with them. And they were encouraged us to continue to communicate so that Joe was able to share a few things that are coming up that they were unaware of, that will help them to be watchful for. So it was a good conversation. And I think that that is all that I have to report. If somebody has any questions for me.
I have a question that has nothing to do with what you said. I don't come up here very often, sorry, but that's probably a good thing. But I came up to pick up a couple of friends that have had colonoscopy, and I saw the sign that said 5 stars. Could you talk about that?
Sure.
And I don't even know how long it's been up there, so.
It's been up there, come up on a year. The last year, Bartlett was the only 5-star hospital in the state of Alaska. And so the CMS recognition that goes back to patient safety and quality, Well, that's So it goes to those metrics. So we were recognized for our high level of care, patient satisfaction, patient safety. There's a unfortunate piece of this is that it's reweighted every year. And next year will be shifted back to a 4-star facility. Not soon, there was one 5-star in Alaska this year, but it's not us. It goes back to how they recognize hospitals. They put them in different tranches, and we got our quality remained relatively the same, but I think one more infection, we would have 5-star ago.
It depends on how many buckets you can put data into, and last year we were able to put data into 5 buckets. And this year we could only put it into 4 buckets because we didn't have enough infections. So instead of putting data into 5 buckets, we could only put it in 4 buckets, which has a lot more hospitals. So if we hadn't had an infection, we would have remained a 5-star hospital. So I would think that we are an excellent 4-bucket hospital for 4 stars rather than have a patient with an infection. So I will take 4 stars.
Because our hand washing is so much.
Exactly. Charlie is doing a great job.
Hard to throw out something I say.
Did that answer your question? Yeah. Right. Any other questions for me or our assembly members? Seeing that, I think it's time to move on to the calendar. I would like to propose before we go forward asking the finance and the planning committee, if they're good with that. We have, I'm gonna let Joe discuss a little bit more, but I would like to propose that we move our board meeting, our monthly board meeting from the 23rd to the 30th. We have the opportunity for the folks from Stroudwater that completed their
Strategic financial operational assessment.
they're going to be here, they're ready to present and they're available on the 30th. So if we, they will come regardless, on the 30th. They're going to spend the day, my understanding is, Joe, you can step in anytime. They're going to be here on the 30th. They're going to work with senior leadership and staff on their findings, on plans moving forward. And we would like them to present to the board. Ideally, and we will have, if we don't move the monthly board meeting, we will have a special board meeting on that day anyways, to give the opportunity for the board to hear what Stroudwater has to say. How?
Yeah, Madam Chair, I was going to have to ask for the second time, I think, since I've been on the board, to be excused on the 23rd, because I'll be in Galway, Ireland. So if we could move, if we could be on the 30th, that would work well.
Oh, so you're in favor of that? Okay. We realize that it is the week of the 4th of July. 4th of July, I think, is on Saturday. But so those of you who thought you planned to take the week off, that might not be as convenient as you would like. But
I'm okay with 30.
Yeah.
okay. Okay, looks like we'll have a quorum. And Dr. Tini?
Yeah, that day works for me too.
Okay. So now I want to go back to the planning committee. We're still on, okay, planning committees, finance committee, we thought we moved on.
Yeah, I think the packet was already put together.
Okay, so. And there was, the reason we couldn't have it on the 19th was. That's right. So, so finance committee, that the two of you that are here, an alternate, I know
We
you're
already
right.
set, but we already chose the 18th as an alternate.
That was based on the board being that next Tuesday. If it moves to the
Right.
30th, I think finance would appreciate a few more days to complete the packet. And so we're gonna go to move it into the week that, what would have been?
It's been.
Yeah, if you move to the 26th, that would be, I think, very much appreciated by Angela and her staff.
Extra care.
And does that work for you, Dr. Taney? The 26th?
Oh, I won't be available the 26th. I'll be out of cell service on that day.
Well, is there another date that week that would work for you?
The 24th through the 27th is when I'm gonna be out. The original change to the 18th was good for me, but that next week is not.
Would Tuesday, the 23rd work for you?
Yeah, I could do that.
And yes, I'm participating remotely, still at noon. Do we need to check with Max, see if that works for him?
Yes, we do.
So,
But I want to, yes, I give some alternate, propose an alternate. So, let's put a placeholder on the calendar for the 23rd with the understanding that that's not fixed yet without the concurrence from the chair. Does that work for you, Dr. King?
Can I jump in again?
Sure.
The 23rd would work, but it would have to be after, have to be after 3, at 3 or later for me, because I'm working that day, so.
That also works for Jeannie. So
Okay,
let's shoot for that. 3:30? Something like
That
that.
that'd be fine.
All right, with those couple of changes, we're moving the board meeting to the 30th. And the finance committee meeting to the 23rd at 3:30. I would enter in any other comments or questions. Seeing none, I would entertain a motion to approve the calendar as amended.
To approve the calendar as amended.
Second.
Okay. Any board comments or questions? Before we roll into executive session?
I would comment. I love the graphs. I really appreciate your visualization. Thank you.
Any others?
I have just one quick one. My niece had a baby at Bartlett a couple weeks ago, and she raved about the care she received from all of the staff. Ended up with us. Not the birth experience she wanted, and was so positive despite that because of it. That was a good experience.
Am I the only one leaving? We do need a motion to go into executive.
Madam Chair, I move the Board of Directors of Bartlett Regional Hospital recess an executive session to discuss several matters, including those which by law, municipal charter, or ordinance are required to be confidential and involve consideration of records that are not subject to public disclosure, specifically the credential report, medical staff meeting minutes, patient safety dashboards, legal updates, and CEO incentives for compensation. And Madam Chair, I ask you to give them to discretion as to which staff should remain.
Second.
Okay. We're adjourned to executive session. And I would,
Yes,
so, how do you want to? Or somebody.
Well, I move that we accept the credential.
Sorry.
And then I'll move that we authorize the president of the board and the chair of the finance committee to work with the CEO on a, is it contract? Was that the word?
Performance-based.
Performance-based, Scott?
Compensation.
Compensation agreement. Yeah, thank you.
Second.
Is there any discussion or objection to that? Seeing and hearing none, that motion is approved. And if there's nothing else to talk about, I think we are adjourned. All right. Thank you all.